everyone. Today we have Victor in the chair. We'll be doing FUE hair restoration for Victor. We're targeting around 3,100 grafts and PRP. We will be reinforcing Victor's zone 1 and zone 2, the first few centimeters in the following. You've had a prior procedure, correct?
Yes.
So you can't really tell that he has any hair loss the way he has his hair comb, but once we pull it up, you kind of get to see the bare areas, the temples, the density behind it. And this is what he had, was it 13 years ago?
Yes, around
13 years ago, he had the strip. So not too much density, plus over time, I'm sure he's lost some of the density as well. But what we want to do is we want to give him a really awesome hairline and density behind it. And if we have any extra grafts, also future-proof in between if there's enough room. And PRP. So Victor, what you have, we can't really raise the hairline because you have pre-existing. So what we're going to do is we're going to keep what you have and just reinforce and improve the look of it and add density, okay?
Awesome.
So what we're going to do now is we're going to shave the donor region. Bring your chin down a bit. Thank you. If I could have a comb again. The quality of your hair is super awesome.
Thank you.
The donor region. Thank you. And then we're going to keep the hair long for now on top. We're just going to clip the donor. Have you seen your strip scar from the past?
No, it's been a while.
It's been a while.
I always keep my hair long enough to
Cover it?
Yeah.
Are you going to repair the scar with scalp micropigmentation?
Yes.
You are?
Those are my plans.
And this is one of the benefits with the FUE, is you get to have the option of shaving your hair super short, or I should say clipping it, without having really visible signs that you've had a prior procedure on the donor. If I could please have a marker. We're going to outline, Victor, your donor region, okay? You're going to feel a little marker. We don't want to go too high and we don't want to go too low on the donor. So what we're doing now, Victor, is we're making a grid so we could target equal number of grafts from each square, okay?
Okay.
You have a little scar back here. Maybe as a kid you fell.
Yeah, as a kid.
You bumped your head. Bring your chin down a bit. Beautiful. How long have you been wanting to do this?
I want to say about 5 years ago.
5 years?
Yeah.
And the first one you had was 13 years ago.
Yeah.
Back then there wasn't a lot of clinics. There weren't a lot of clinics doing the FUE. Alrighty, Victor. So guess what?
The good part's coming up.
Which part?
The good part.
The good
best part.
The best part. Exactly. Absolutely. So what we're going to do now is we're going to numb your donor region, starting at the right temple,
Okay.
and then above it. the left temple, and then above it. This is the worst part for this phase. It's gonna go by super fast, okay? If you could take this, the rest is super duper easy. You're gonna feel a little vibration device as well. Take a deep breath for me. On the count of 3, here we go. 1, 2, 3. You're doing awesome. We're almost done here. You did fantastic. And now we're gonna do the top portion. Here we go, 1, 2, 3. We're almost done. 3, 2, and 1. Perfect, you did it, good job. How bad was that?
So let's give you some juice.
Like a 2.
A 2 out of a 10? Wow, that's courageous. Most clients say 5. Alright. What we did on the right, we have to do the same on the left, okay? You're gonna feel a vibration. This left side is much smaller. Here we go, 1, 2, 3. Almost done, you're doing awesome. Beautiful, and then the top portion. 1, 2, 3. That's it, you did it. Good job, Victor.
Alright.
Worst part is over, my friend. Good job.
Awesome.
Alright, so what we're gonna do now, Victor, is we're going to ask you to stand up in about a minute or 2, and we're gonna get you in position. We're gonna have you on your stomach, and we're gonna start the harvesting phase, okay?
Okay.
The rest should be easy, and this is where a lot of clients feel very comfortable because of the medication we gave them, and most of the time they fall asleep. It does not put you to sleep, but you can sleep if you want to.
Okay.
Okay? All right. How are you, Victor? Doing good? Any pain?
No.
No? Good. We're 95% done. We just have a few more squares to go into, okay? All right, Victor, we're almost done, okay? We're harvesting your grafts. So far, they've all coming up multiples. It's a double. It's a double. How painful has it been so far, Victor? Doing okay?
I want to say a 1.5.
1.5 out of 10?
Yeah.
That's really awesome. You don't feel any of this, right?
No.
I know the position for you is
Just
a little
the position. That's the only thing.
bit. Your neck, but we'll be done in 5 seconds.
But other than that, everything's not painful.
I think this is the last one. Yay. Nice triples. Okay, Victor. We're done with the harvesting phase. How was that?
It was a good experience.
Was it painful?
No, it was like a 2 or 1.
2 or 1?
Yeah.
What was the worst part?
The
Positioning?
The position, yeah.
Was it because you're not used to being in your stomach?
Right. I'm not used to. I don't sleep in my stomach, so.
Okay. All right.
That was the hardest part.
It went by quick. Took us
Yes.
about 2 hours and 15 minutes.
Wow,
Yeah.
it seemed like an hour. Or
Well, it's the medication we gave you. It makes the time feel very short. Okay. Awesome. So let's find out how many grafts we have and what percentages. Okay. Flor, if you could give us a breakdown of how many singles, doubles, triples, and how many total grafts. We were aiming for 3,100.
Perfect. So we have singles 789
Okay.
with 25% there. Doubles we have 1,414, 45%. And triples we have 972 at
Okay.
30%.
And what's the total? All of the grafts
We have
calculated?
total of 3,175.
Okay. So we were aiming for 3,100, and we have 75 extra, which we could use. What's the percentage of the doubles and the triples again?
Doubles and triples, doubles are 45%, triples are 30.
Okay, so we always like to have more triples than doubles, okay? What's going to give a patient more density? Not necessarily the number of grafts that they get, but the quality of the grafts, meaning how many hairs does every single follicle or graft contain. So for you, this being your second procedure, actually those percentages aren't bad. You having 45% double with 30% triples, was it? 30% triples. We usually like to have more triples than doubles, but we have to also consider you've had a prior strip technique or a prior procedure, and sometimes when there's pre-existing scar tissue, it can miniaturize the donor region where the stronger grafts, they start to reverse and they start to thin out. So, but that being said, overall you still have 45, 55, 60, over 75% doubles and triples, which is a good ratio. Alright? So now we're going to work on the design. The design is already there for you, okay? We can't really do much in regards to raising the hairline because you have that pre-existing. What we're gonna have to do is just reinforce it and just improve the look that you have. We're gonna take a few measurements. First, we're going to disinfect the scalp. Look straight ahead for me, close your eyes. So you are at 14 centimeters. Ideal location for a hairline would be at 7. Right now, you are at 6.5. So your existing hairline right now, Victor, is actually 0.5 centimeter to almost 1 centimeter lower than we would like, but we have no choice but to go with what you have to reinforce it, okay? All right, so let me show you the mirror. Take a look at this. And ruler one more time. If you look at the distance from here to here, you see how that's 14?
Right.
Half of 14 would be 7. From the eyebrow up, this is where 7 is. You see that? Right here. You are at 6.5. Right there. So you're about 1 centimeter lower than the ideal location, but this just means that you're gonna have more of a youthful, aggressive hairline. If I had done the first procedure, I would have done it more into equal balance, where the focus goes to the middle of the face versus on the forehead or on the chin. So when the hairline's too low, the chin looks too long. When the hairline's too high, the attention goes on the forehead. But if we have equal proportions, the attention now goes to the middle of the face. Now this isn't right for everyone, it's just a general idea, okay? All right. If I could please have alcohol. Thank you. Let's have a comb as well. So when it comes to a hairline, Victor, I mentioned this in all of our videos, is you don't want to have a hairline that's too perfect, too symmetrical, okay?
Right.
You want to have an irregular, and you want the right and the left to be somewhat asymmetrical, not identical. Make sense?
Yes, it makes a lot of sense.
All right. Okay. There we go. Okay, and now let's do something on this left side. Turn slightly this way a bit. Let's add some alcohol. Beautiful, I like it. The right and the left, pretty similar, but they're not 100% identical, okay? Alright. So what I'm going to do next is I'm going to break down the zones. As you know, zone 1 is the first 2 centimeters. Turn slightly this way. Let's turn this side. So let's figure out how many grafts your zone 1 is going to chew, okay? So how can we find out? We first need to know what your surface area size is, okay? So for us to be able to give any client or patient a recommendation, surface area is important. So zone 1, let's have a mirror. Take a look. Zone 1 is the first 2 centimeters. You see that? Where the hairline starts.
Right.
And let's see how far it goes to connect to your temple. You're at 9.5, almost 10. Do you see that?
Mm-hmm.
Okay. So what does this mean? How many grafts is this right side alone going to take? If this is 2 and this is 9.5, you have a surface area that's 19. All I do is I multiply 2 times 9.5, 19. What I did on the right, I have to do the same on the left. 19 and 19 is 38. Does that make sense? Is my math right? Mm-hmm. Alright, so this basically means when the client needs restoration with your dimensions, typically from the center to the temple, it's 8. Yours was 9.5. So you have 1.5 extra centimeters going towards the right, going towards the left. And since zone 1 goes back 2 centimeters, you have extra 1.5, 1.5, extra 3, total extra 1 centimeter squares. Does that sort of make sense? All right. Basically, this means I now have to fill 19 squares here, 19 squares here, each square being 1 centimeter in size. Can I have a calculator, please? So if we have the surface area 19 times 2, which is 38, and place at least a density of 70, your zone 1 is going to chew roughly around 26 to 2700 grafts. Okay. Then, this is the next area we call zone 2, which is the following 5 centimeters right here. Most of your zone 2 is nice and full. Now the area that could use restoration is right here on this right side, almost like a triangular slice. Slice of pizza almost. You see that? The shape of it? And now, let's break down your zone 2. Let's have another marker. Right here. This is the next area that's going to use the most amount of density. Most of the zone 2 you have is actually pretty good. We're going to reinforce a little bit here. This right side is the largest. Are you able to see that right here?
Yeah.
Of zone 2, and then the left. What do you think of the design?
I love it.
You like it?
Yeah.
So we're not really changing your look. It's what you have from your first transplant.
Right.
So I have no choice. I don't want to give you super aggressive to cover this. These existing hairs you have will just act as softeners in the front.
Okay.
Does that kind of make sense? Almost like baby hairs.
Right.
Although these are coarser, it's just the texture of your hair. But the goal is the line at density behind that hairline. Okay. Same on the right side. You have these hairs in front of the line. These will act as softeners to create that irregular look. Some of them are actually doubles and triples.
I can see it.
You see that? They
Yeah.
have multiple hairs. The hairline should all be singles to give you the most natural appearance. Okay? So, what do you think?
I think I like it.
You approve?
Yeah.
You like it? Alright. I'm gonna take some photos. Alright, Victor. When was the last time you had your head shaved?
Wow.
A long time ago?
A long time ago.
Okay.
Lord.
Here we go. Alright, Victor, I'm going to show you the mirror. Show you what this looks like. Okay? With your head buzz. Alright. Let's have a mirror, please.
Right.
Ah, awesome.
Oh,
You're
man.
sneaking up on me. What do you think? Let me see. I like it. Yeah. Right and the left, not perfectly identical, which is what you want. You want the right and the left to be somewhat asymmetrical. Now, the only thing you have that's pre-existing are these hairs in front. You see that?
Right.
Especially on this left side, they've gone down too low. So if I can have a pencil. So if they, pencil. Thank you.
You're welcome.
So if I was to recreate the design they gave you, this is what it would look like. You see that?
Yeah.
Which we can't really do much about.
Right.
Alcohol, please, white. That's not going to look natural. It's almost like a female pattern angle, temple angle.
Right.
So what I did is I not raised, but matched it to what you have on the right side. Otherwise, you're going to have a hairline that's going to be like this. And then this side is higher, and this side is lower. Do you see what I mean?
Yes.
They didn't give you the same design on this side. Otherwise, it would have looked more like that. But I'm glad they didn't. But in the future, once all of your hair starts to grow, your left side, you will have some of these irregular hairs in the front. You could probably get rid of by electrolysis or plucking them out or shaving it. But I wouldn't want to give you, just for that corner, a hairline that's not going to look as natural. Does that make sense?
Yes.
Okay. What do you think?
I like it. I love
You
it.
like it? Okay. So the plan is, if you look at it in the mirror one more time, fill all of this up. Fill all of this. This is going to chew around 26 to 2700 grafts. Then we're going to target this right side of zone 2, which was the barest. Then this left side, anything extra, we're going to future-proof this middle area.
Okay.
And we're also gonna do PRP for you as well later
Okay.
on. Okay?
Thank
You approve? You like it?
Yes, sir.
Awesome.
Thank you.
So guess what? You're already halfway done through the day.
Alright.
So what we're gonna do now is we're going to make incisions. Incisions are where the grafts are gonna go into. Okay? So you basically have about an hour and a half for this phase, and we're gonna break for lunch.
Okay.
Sounds good?
Sounds good.
Awesome.
Thank you.
You're welcome, Victor. Alright, Victor. What we're gonna do next is we're going to have to numb the scalp. Okay, how's that done? 2 quick pokes on this right eyebrow, 2 quick pokes on this left eyebrow.
Okay.
Okay, I'm gonna disinfect it. You're gonna feel a little vibration on the forehead. Alright. This is the worst part for this phase, okay? But it's gonna go by super quick, super fast. Take a deep breath for me. Inhale, exhale. Alright, I'm gonna palpate. Quick poke here, quick poke here, quick poke here, quick poke here, okay? Don't make any sudden movements. I don't want the injection going anywhere else except where it has to go. Alright, take a deep breath, inhale, exhale on the count of 3. Here we go, 1, 2, 3. That's it, super fast. I'm not gonna lie, this will sting. And here comes the second one, don't move. 1, 2, 3. That's it, you did it, good job. Super fast. These are tear jerkers. There you go, have some juice. As a distraction. Alright, what we did on the right, we have to do the same on the left, okay?
Okay.
Look up towards the ceiling. Alrighty. Quick poke here. 1, 2, 3. That's it. And here comes the second one. Right here. Don't move. 1, 2, 3. You did it. Good job. Good job, Victor. Alright, I'm gonna go back in this right eyebrow. It should be completely numb. Here we go. Don't move. Any pain?
No.
Here comes the second one. Any pain?
No.
Perfect. Same on the left. Any pain?
No.
Any pain?
No.
Okay, awesome. Guess what, Victor? This was the worst part and you did it. The forehead's gonna feel super numb. The reason why we did the eyebrow is it kinda goes up like this and it numbs a majority of the scalp, not so much on the temples. So all you have right now is a few seconds of numbing on the right temple and on the left temple, okay?
Okay.
And if you could tolerate that, the rest is a straightforward, no pain. Few seconds. I'm gonna give you 2-3 minutes. Allow this to work its way up, and we're gonna get started. How's it going, Victor?
Great. I just feel, just tight. My head a little bit tight, but I have no
Pain?
pain. No pain at all.
Comfortable?
Yes.
Awesome. So Flora's gonna come in. She's gonna start drawing blood for the PRP, okay?
Okay.
Try to keep your head steady for me. So you're done with zone 1, right and left. So now we're working on that right side to add the density where it's the thinnest. You have about 600 or so left. Alright, Flora, feel free to start the PRP.
Okay, Victor. So keep your head nice and still for me. I'll do all the work here, okay? Your arm nice and steady.
You're not gonna feel a thing, okay? We're gonna use the line that's already in your arm
Okay.
for the blood flow.
This might feel a little cold. I'm just gonna flush the area.
You have a scar up here
On my head?
on top of your head. Did you hit your head as a kid?
Probably. Yeah, I don't remember.
Yeah, there's an area that's about centimeters. It's a linear scar. Side to side. Looks like a scar from when you were a kid.
I remember now. Yeah. It
You
was
remember?
Yeah, it was a pole.
Mm-hmm.
I was around 7 or 8 years old.
Oh, you remember.
Yeah.
Almost done.
No pain, right?
No pain at all.
Beautiful. We should be done about 5 minutes.
Awesome.
We're gonna have lunch ready for you as well. And when you come back, we're gonna finish today with the implantation. So, Victor, what are some of the benefits of PRP? It helps with recovery, sooner growth. It's shown to also help with the survival rate of the grafts. So you'll be surprised how quick your recovery should be. It's the advantages of the PRP. It's the body's natural way of healing. You just take a concentrated level. And the best thing is, when you do it the day of a procedure, is you don't feel a thing when we inject it to the scalp.
Ivy wide open.
Yes, please.
All set there. Thank you. And lunch is on its way.
Beautiful. What'd you order?
I believe it was the ribeye, the steak.
Ribeye steak. Nice. Oh, that's a very common order. People love it.
There's no pain at all. I don't feel nothing.
Good. Yay. All right, Victor. How was lunch?
It was awesome. It was
Lunch
really
was good? What'd you
it was
have?
really good. I had a steak.
Yeah, the steak.
Yes. It
Medium
was,
well, rare,
It was well done.
or extra well done.
Well done.
I don't eat steak, but if I did, I'll do the same.
Yeah, it
I
was-
can't have it when it's too bloody.
Yeah, it
All
was
right,
really
Victor.
good.
You haven't seen it yet, have you?
No, I haven't seen it.
You want to take a look?
Yes.
All right. So keep in mind, everything you see now is swollen, okay? So the hairline's gonna drop. So this was your existing. All of your zone 1 is double density, and then this zone 2, right and the left, right side is larger than the left side, okay?
Wow.
So now what we're gonna do is we're gonna do the PRP, and we're gonna start the implantation phase, okay? A few more hours, and you'll be done.
Awesome.
What do you think? You like it?
I love it.
Awesome. So wait till the grafts are in. Okay, it's gonna look more complete.
Alright.
Awesome. Let me grab this for me. Alrighty. Alright, Victor, we're gonna start the PRP, okay? You're not gonna feel a thing. Any pain?
No.
Beautiful. So singles for the hairline, of course. Triples up to this line. And then doubles. And then singles here. Ones and then twos, 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 and twos. And singles for the hairline. Ones on the left side. All right. All set, guys. Alright, Victor, congratulations. You did it.
Thank you.
How was it?
It was awesome.
Jeez.
It wasn't as worse as I thought it was gonna be.
Was it pretty bad?
It wasn't.
It was good?
Out of a 10, I say a 2.
Two pain scale?
Yeah, 2.
Man, I wish everyone said it was a 2. Most say it was a 3 or 4. The needles are the worst part, right?
Yeah, the needle in the top part, but I mean,
Alright.
it's nothing that you can't bear.
So, going to dab just lightly. You're gonna have super awesome density. Hopefully the scar tissue from your previous procedure doesn't get in the way, because of course when clients have had prior procedures, sometimes the scar tissue can cause lack of blood flow to that area. But your skin looked very healthy. Your donor was awesome, although you had that strip scar in the back.
Right.
So don't touch the top, okay?
Okay.
We could do it because we know how much pressure to apply. Once you leave the office, you no longer should touch the scalp.
Okay.
Alright. Just cleans you up. We're gonna let it air dry. And now we're gonna give you the mirror. And show you. You haven't seen it, right?
No.
Obviously. Alright. Alright, Victor.
Wow.
What do you think? You like it?
Yeah.
So the hairline is nice and irregular. Like I mentioned, these are the pre-existing hairs that you had.
Right.
Okay. The hairline's gonna come down next few days. It's swollen right now. But look at that awesome density. We took the hairline, we connected it to the temple. This is called the temple angle closure. This is what's really going to frame your face. Okay. Now keep in mind, results will take 6 months to achieve 50%, a year and a half almost to see 100% results. So we get a lot of clients who watch the videos and they say, where's the end result? Well, we just finished the procedure obviously today,
Right.
and we're not gonna have the results till 6 months after. But what I want you to do, Victor, is if you could keep in touch with us,
Of course.
send us updated photos, and we will update it on our Facebook page and on our Instagram page.
Okay.
And our Instagram page is la.fue.hair.clinic. So we have to wait 6 months to see your results, but you're gonna look fantastic.
Okay. Thank you so
Alright.
much.
Do you like it or do
Yes,
you
I
love it?
love it.
That's
I love
my
it.
phrase.
Thank you so much, and I also
People
love,
say you got a trademark.
I also love the hospitality. You know, everybody treated me like family here, and I felt really comfortable here.
Awesome.
So, and the food was really great.
And I'm
too.
glad you enjoyed the steak, because a lot of people write comments, they go, I don't think they serve steak. Who has an appetite to eat steak?
And let me tell you, that steak was really
It was good, right?
Yeah, I even
Malbeck's
want to come
across
back
the
another
street.
day. My personal, you know.
It's right across the street.
Yeah, and I want to come.
Sounds good.
Thanks a lot.
You're welcome. It was a pleasure having you. Thank you.